Guys, here is another video, clinical skills video related to a focused assessment. So today's focused assessment is going to be all about a skin assessment. A skin assessment is so key, and this is one of my soapboxes skin is probably the least well-assessed organ of the entire body, and it's also the biggest one. It's everywhere. As much as I love my cardiovascular system, I also know how important it is for skin to be assessed. So, and I like my students to do a very thorough skin assessment. So remember, this is my take on the skin assessment. Your instructor may want you to do something different. So always pay attention to what they're telling you. And I always can miss things too, because trust me, I'm not running from a script here. I'm going off of my brain and hoping that I remember everything. So at the end of the day, we're going to start skin assessment at the head. I'm going to come over here. So as with all of our other assessments, we're always going to start by asking about a history. So any history of skin problems, we're going to ask about any history of maybe skin cancer, any history of skin breakdown, any ulcers, have they noticed any skin issues? We might ask about history of stuff that can cause skin issues. Do you have a history of diabetes? Do you have a history of peripheral vascular disease or peripheral artery disease? We want to ask about anything that's going to affect blood flow, which could cause them to have breakdown of tissues. So also like even venous disease, they can have venous ulcers and things like that as well. We might want to ask about history of psoriasis, a history of herpes zoster, which is also known as shingles. Want to ask just about, do they have an affinity? When they get a cut, does it heal pretty quickly? That kind of stuff as well, kind of check on their immune system. So when it comes to a skin assessment, you can kind of integrate it into your other assessments. But if I was just assessing this person's skin, I'm going to just focus on the skin. So when we're looking at skin, we don't want to just look for breaks in integrity. We want to look for the quality of the skin. We want to look in general, what's the color of their skin? Is it match what their skin tone should be? Is there any abnormalities like they might have? Like some people might have discolorations of their skin or alterations to their skin color throughout their body. So you want to be looking for those. You also want to be looking for any signs of any rashes, previous scars, skin breakdown, cuts, sores, things like that as well. And they can be anywhere on the body. So you have to be a good skin detective. And the biggest advice I can give you is you have to look under everything. Don't assume because like they're young and healthy, they don't have anything under it. I can't tell you how many times I found an IV under a blood pressure cuff on a patient's arm, or stuff that the nurse didn't even know, but because they probably didn't look, underneath everything. So when you do a skin assessment, you can start with the head. You can look around and feel around. I've never honestly felt someone's scalp in my life. I've cleaned bugs out of someone's scalp. I've never felt someone's scalp, but if there is an issue or you're concerned for something up there, you can do that. But I'm looking around. I'm just going to be looking. I'm looking behind everything. If they have any devices, like I work ICU, so they have devices like their breathing tube, I need to look under anything. So if they have some sort of device, let's say they have a trach or something and they have ties, I always need to look underneath the device, because I can't tell you how many times we get these really bad pressure injuries right now. Like the highest level of the more prevalent pressure injuries that are coming up are ones from devices. So any device that's on a patient, especially one that's on them around the clock, I need to check under. That might be a cast. That might be, if they have a continuous like blood pressure monitoring and they have a blood pressure, I need to look under that. It could be something that's in their mouth, or even if they have like glasses or something like that, I want to be looking for pressure anywhere. So I want to look under all devices. I want to look in their mouth because they can have skin integrity issues in their mouth. I'm going to look down and I'm going to just take a little bit at a time. I don't need to strip them down, but I can go little by little, look at their chest, look for any scars, abnormalities. I want to also look for IVs, tubes, and drains while I'm at it. And I've talked about this in other videos, but anytime I assess a line, tube, or drain, I always start at the patient first and see what it looks like on the patient. Like he has a central line right here. And then I'm going to follow it all the way to whatever it is. So let's say that he had oxygen on. I'm going to start here. I'm going to look for any breakdown or anything around his skin here, around his ears, because they have those, those little things around their ears. And even if they're wearing those protectors, they still can get breakdown. So I'm going to check his ears here. And then I'm going to follow back up because I want to know what my order is. I've had multiple times where I go in, a patient's not breathing well, and I'm like, oh, their oxygen's in. I check to make sure it's in their nose, but the oxygen's not turned on up at the actual oximeter. So you always want to check your devices, and it's your job when you first come in, because maybe they just came back from the bathroom and they forgot to turn it back on. Maybe something happened, maybe their IV is supposed to be connected and it's not, but it's your job as a nurse, especially when you do that first assessment. And that's why it's great to do a bedside report, so you can look at these things. Hey, is this supposed to be hooked up? How much is it supposed to be at? Hey, is their IV supposed to be hooked up? What is the rate? You can go through these things at the bedside. So I'm checking their chest, and a lot of people can have IVs or devices on their chest. So I want to look for those. If they have EKG strips, if they have any extra stickers on them, please take them off. The people will leave them on forever, and the longer you keep them on, the harder it is to get them off, and they can have permanent sticky marks on them forever. So anything that's not necessarily any extra stickers, any Band-Aids that have been on for more than a few hours, they can come off. It really helps to protect their skin integrity over time. So take off anything extra that you see. Look here, I want to start looking in folds. So for this patient, I'm not going to, it's kind of hard to do with the mannequin, but I'm going to look under the armpits. A lot of times in the neck folds, I can look for changes in color. Patients that are pre-diabetic and insulin resistant can have what's called acanthosis nigricans. It's like a darkening of the tissue. I might look for that, or any signs of insulin resistance there. I'm going to look for any breakdown, any problems there. I'm going to go down their arms, and I'm looking for integrity. I'm looking for any edema, any changes in color, any changes in temperature, to kind of see how their flow is, because blood flow is extremely going to affect their ability to have good skin integrity. And I'm looking under any devices. So if there was a blood pressure cuff here, I would take it off and look underneath. If there's an oxygen probe, they should change those regularly, change fingers so there's not that same pressure. With their bracelets, look at how tight they are. Some people put them on super tight and it's cutting off their circulation. Also, if they come in with jewelry, look to see that, like I always try to take off, if they have rings when they first come in the hospital, take them off. If they are not if they're really like low maintenance, they're not there for anything, you could probably leave them on. But I say as a whole, it's best to take off jewelry, because usually, like when you're in bed, your hands start swelling up and then they can't get that off, and then they need to go to surgery. We have to do crazy things to get jewelry off. So take off all jewelry if they're will allow you to. So I'm checking my arms. If there's any IVs, I'm going to assess them. I'm going to assess that IV site, make sure that there's no problems there. Look for any alterations in integrity. I want to look in between the fingers on both sides of the hands. After I do the chest, then I would, as we like to keep as much modesty as possible. So I'm going to pull up my patient's covers and just look at their abdomen. So I'm looking for any abnormalities. There could be a lot of devices here. There could be ostomies here. There could be previous scars. Could be, some sort of issue when it comes to, breakdown. The biggest thing that most people have that this gentleman does not have is a pannus. And what a pannus is, it is the large fat tissue at the bottom of the belly that smiles at you when you're looking at it. And so you want to lift that and look underneath. And I'm going to tell you scary stories at JPS where we've actually found like a full rotisserie chicken underneath someone's skin fold. And I'm not joking. I'm 100% serious saying that. We have found food, we have found bugs, we have found animals, we have found a lot of scary things underneath fat tissue. So you always want to look underneath and see what you can find underneath. Hopefully you don't find anything, but if nothing else, you want to make sure there's no redness. A lot of people that have skin folds, they can get yeast infections and stuff like that. So we may need to get them a fungal powder for that. So I'm looking for any alterations here, any lines or tubes. Again, if there's lines or tubes, I'm assessing, starting at the patient, moving out to the device. Then I'm going to do a good reproductive assessment, genital assessment. I'm going to look for any breakdown. There's people that come in with STDs, fungal infections, other skin integrity. It's a moist area down there. Anywhere it's moist, it's a risk for a problem. So I want to do an assessment there. Then I'm going to make my way down. And again, like the arms, looking for edema, looking for devices, looking for problems, for scars, for any changes to color, any changes to temperature, all the way down to the feet. Now let me get my camera turned here. Especially one of the most important places to look for breakdown is going to be down here at the feet. So you can see that our gentleman here actually has some breakdown on his toes, but the other place, and on his heel. So this is the most important thing. People will get this far, but they don't look under. Always look under and look at the heel and see if there's breakdown, because this poor man does have some breakdown on his foot. So I want to look at it, assess it, and document that. And then I'm also going to lift up this heel and see if he has anything on this side. I'm looking all around in between the toes, looking for any fungal issues, etc. Um, at the beginning of my shift, or as soon as possible, usually with my first turn, I like to turn them on their side. And I'm not sure if I'm going to be able to do it with this mannequin, but I will do my best to kind of show you. I don't want to dislodge anything. So I'm going to look at their back. I definitely want to look up and down their back, make sure there's no breakdown, no dressings or wounds. I want to especially look at the bottom. You want to look here in this crevice, and then in between in the around the rectal area on their cheeks where the most pressure is. If this is a very skinny patient, I'll especially want to check their hip bones and other things as well that may have breakdown. Pretty much their pressure points that they're going to have in the bed. If the patient has any devices like casts or braces or anything like that that they have attached to them, I want to look underneath those. If I have an order not to remove them, I want to look everywhere I can right around the device to see if there's any breakdown. Don't forget to look at the back of the head and the back of the neck in case there's any pressure there. And as you're taking care of your patient, always make sure to keep your bed clean. I turn patients all the time and find like caps and other stuff, especially when they come up from the emergency room. They have a ton of stuff in their bed, which I get. But that stuff, like that's where they end up with pressure ulcers and pressure injuries, excuse me, is because like, someone leaves like equipment in the bed and it pushes up against them. So whenever you're regularly turning them, try to keep their sheets wrinkle free to prevent that breakdown. And then also make sure there's nothing left over in the bed with them, or none of their lines or tubes are putting pressure on them. Because let's say that it's a total care patient, they can't move themselves at all, and they have their IV tube and their like arm is pressed on along the cap portion, they can get some pretty bad breakdown on their arms. Always be looking. You want to keep your bed and your sheets clean and free of extra equipment and materials. You don't want anything rubbing up against the patient. That is a basic skin assessment. I know it seems like a lot. You can kind of do this as you're going down and doing your beautiful other parts of your assessment, but you really want to just make sure that you are hitting all of those highlights for that patient. Really, again, looking under everything, looking underneath any skin folds, looking for any problems. Remember, common problem places are going to be underneath that stomach fold in the bottom of the stomach, underneath the heels, looking at the back or the buttocks, areas that are commonly sometimes not found. Even if it's a young, healthy patient, maybe they even have clothes on, they don't have a gown on, you still need to assess for skin because you just never know where they might have some breakdown there. So yeah, I hope to see you guys in the future taking very good care of your patient's skin. I know sometimes it can seem like a lot and a pain, but the worst thing in the world is when a patient, they're there for a different problem and end up with skin issues, skin breakdown. All of that can be prevented with a very thorough skin assessment. Thanks, guys. See you next time.